Spinal Immobilization, Supine.
Hello, I'm Angie Lomeli and I am an EMS instructor. I'm presenting you with a series of EMS educational videos. Now, whether you are a first responder, a student, or just someone simply interested in learning more about the wonderful world of EMS, these videos are for you. Now, the videos are made so that you may watch and follow along as well as practice while watching. Hopefully, you'll find these videos helpful during your lab skills and testing. Good luck with your venture, and let's get started.
Performance objective. The student must correctly demonstrate the use of a long spine board on an adult patient by performing all of the listed steps. Taking more than 15 minutes is a fail for this skill. Conditions. The patient is lying supine on the floor complaining of back pain. A helper is immobilizing the C-spine. Note: the body shape of the patient may not conveniently align with the position of the holes on the available longboard. Minor adjustments in the selected strapping holes may be necessary to assure the patient is secure. Strapping should be initially placed properly, not with the intention to move it into place after it is on the patient. Standards. The standards are incorporated into the checklist to be used by the scorer. Equipment: long spine board, 2 to 4 student helpers as available. C-spine bag containing 5 straps with buckles, looped ends. Stay block pad, adult C-collar, cloth tape.
For this skill, we'll examine spinal immobilization for a trauma patient. Participants will be given 15 minutes to complete this skill. As you approach the scene, make sure you're wearing your appropriate PPE, gloves, goggles, and mask, and begin your scene size up. To complete this skill, you'll need several pieces of equipment. I'll go over them and identify them in the order that they'll be placed onto the patient. The first one, after the helmet is removed, will be an adjustable C-collar.
Equipment: adult C-collar, pediatric C-collar. Note: the C-collar may come in 2 sizes, however, the application procedure is the same for both.
Then, the patient will be strapped to the board using a cross strap.
Cross straps.
There are different types of straps. Now we're going to show you how to use the 5-foot straps. One of the ends, which is the female side, will have one strap, one length only. Its partner will be a lot longer and can be adjusted as needed. Now, there are loops at the end of each one of these so that it can get connected to your longboard. You simply bring it underneath, you pass it through, cinch it tight, and you're going to go across. Now you want to have it lined up so that it goes over your patient's shoulder, kind of like a backpack. Now, this strap will be on the opposite side, and you have a loop which you're going to connect also. You want to make sure that you're going in a diagonal fashion and you can clip it. Now, these clips are designed for you to be able to flip them over if by any chance they got twisted. They should work in either direction. Now, if you're working with a partner, communication is key because sometimes your partner will end up on the opposite side with a secondary set of straps, and you may end up with 2 female sides or 2 male sides. So you want to make sure that you are very clear as to which strap needs to be at what part of the body, whether it's over the shoulders or at the hip or from the hips to the lower legs or thighs.
The longboard used to secure a patient will look something like this. It will be wide on one end and tapered at the bottom. The patient's head will go to the wide part. The patient's feet will go toward the bottom part. There will be a series of holes and handles on either side through which the straps will go.
Long spine board.
After the patient is secured to the board, the last step will be to insert the headband.
Severe weather strap. standard strap, side support blocks, occipital pad.
The headbed comes in 4 pieces. You've got the block that goes underneath the patient's head for comfort. It also has a sticky pad underneath so that it remains firm against the longboard. You also have 2 wedges that will go on either side of the patient. The patient's head would rest in the center, and these wedges would be just above the patient's ears. In addition, be careful and make sure that you have the smooth side towards the patient. The other 2 sides have Velcro, and you want to make sure you don't have that against the patient. The reason there's a Velcro on the outside is so that you can use the forehead strap. This part will go against the patient. There's a little pad, and that will sit across. Included in your cervical collar package is a very sticky tape. It resembles duct tape. It is used to secure both the head and the headbed to the spinal immobilization board. I would perform penman. Hello, my name is Angie. I'm an EMT. I'm going to help you. I would instruct my helper to hold C-spine immobilization until I request them to release, and also to ensure the patient's head is maintained in neutral position at all times. I would then proceed to perform movement and sensation exam on the patient. I would hold their hand and ask them, wiggle your fingers, while I'm holding on to their wrist. I would not let them see what finger I'm touching, and I would touch a finger and ask, which finger am I touching? I would do that for both hands. I would then move to the toes and ask, while holding their ankle joints, please move your toes for me. If the person has boots or some other shoe or something that I cannot remove, I might ask them to push down on their foot instead. Then I would ask for sensation. I'll ask patient, which toe am I touching, or which foot am I tapping?
Student states, I would perform penman. Student states, hello, my name is, I am an EMT, I am going to help you. C-spine immobilization. Student instructs assistant, please maintain C-spine immobilization until I request release, and also ensure that the patient's head is maintained in a neutral position. Student checks SM on hands. Movement instructs patient, please move fingers of each hand. Holds wrist joints. Sensation asks patient, which finger am I touching? Student checks SM on feet. Movement instructs patient, please move the toes of each foot. Holds ankle joints. Sensation asks patient, which toe am I touching?
I would proceed to size the cervical collar. Using my fingers, I would visually measure the height from the base of the patient's neck to the patient's chin and adjust collar to correct size. In order to properly measure the cervical collar for this patient, I will take a visible measurement. I'm measuring from the highest part of the shoulder and the lowest part of the chin. And this is kind of my invisible line. And at this point, I'm going to use my fingers, and I would end up using 3 fingers for this case. Now, I will get the cervical collar, and I would measure 3 fingers from the bottom part of the plastic, not the foam. So I would measure it from here. Now, in order for me to place this on, I have to make sure that the locks are off, and the locks are right here and one right here. So you flip over the collar and make sure that it is not locked. Once I ensure it is not locked, I can grab it and lift and lower. At this point, I'm going to choose to put it at the short. So I want to make sure that the red tab is on the short right here. Push the button to snap and lock. Make sure it's on short, push the button, snap and lock. I have seen people accidentally have 2 different sizes, so be sure that you're consistent on both sides. Now, normally when you receive it, it will be flat. So you want to create some curvature. You're going to want to move and create some curvature. Move and create some curvature. And then from the center, also move it to create some curvature. At the end, you're going to want to have a round tunnel. One way to place the cervical collar is to slide in from the front. You push down on one side, and then the longer part, you just slide it under the patient's head and neck, reach for the Velcro, and connect it. You don't want the collar to be so loose that the chin will actually go inside and end up underneath the chin rest. You don't want it so that the chin is so far out protruding that this part is actually pushing on the soft part underneath the mandible. What you do want it is to be at or about the general area of the chin and chin resting together. You also want to pay attention to the ears. If you see any jewelry, remove it. You also want to make sure that the ears aren't bent or twisted so that it causes discomfort to the patient.
Student sizes cervical collar. Using fingers, visually measure the height from the base of the patient's neck to the patient's chin and adjust the collar to the correct size. From sizing post to bottom edge of collar, not the edge of the foam. Student places collar. Slides properly adjusted collar up the chest wall. Assures the chin is well supported by the collar chin piece. Maneuvers the Velcro attachment behind patient's neck gently. Student attaches Velcro securely. Assures patient's nose and sternum always remain in alignment. Assures patient's neck is not flexed or extended.
To perform a log roll, you will need 2 to 4 rescuers. Rescuer number 1 will be positioned at the cervical spine. Rescuer number 2 will be holding the shoulder and the lower thigh. If you happen to have 4 rescuers, rescuer 2 will be at the shoulder and at the hip. Rescuer number 3 will be holding the waistline and the lower thigh. Rescuer number 4 will be in control of the lower legs and feet. The person holding cervical spine is the person in charge of the log roll. When everyone is ready, they will call out 1, 2, 3, roll. The patient will be rolled over uniformly and the back will be examined. They will check for bleeding, deformity, penetrating objects, bruising, or tenderness. Once the exam is complete, they will return the patient to the ground. At the count of the person holding C-spine, 1, 2, 3, down.
Before attaching the patient to the longboard, we need to log roll the patient and palpate the back for any further damage or trauma. If the patient happens to be on level ground, you can position yourself on either side. If the patient is on uneven ground, you need to position yourself on the downhill side before log rolling. Now, with my partner holding C-spine, I'm going to begin to log roll the patient. Ideally, this is better performed with multiple providers, but in this case, we only have 2. On your count, sir.
3, 2, 1.
Okay. Now I'm going to start at the cervical spine and the neck and work my way down, testing for tenderness, deformities. None found. I will bring the longboard to the patient. Bringing the board to the patient, I elevate it slightly. On your count, we will roll her back.
3, 2, 1.
If you needed to realign the patient on the board, you would do so in a down and up motion.
Student positions the long spine board next to and parallel with the patient. The top of the board's hole for the shoulder strap must be aligned with the top of the patient's shoulder. Student instructs 3, if available, untrained rescuers where to kneel at the side of the patient and how to grasp the patient, leaving room to roll the patient towards them. Student explains positioning for 2 or 3 total rescuers. Student directs the rescuer at the patient's head to take control of the log roll procedure. On the rescuer's count, all the rescuers roll the patient towards them at the same time. Student assesses back, observes and palpates the patient's back while the patient is held on his/her side, noting that clothing would have been removed. Student states, "I am assessing for bleeding or deformities." Student performs log roll onto board. Student pushes the long spine board into position against the patient so the patient does not roll onto the edge of the board. Student directs the rescuer at the patient's head to take control of the log roll procedure. On that rescuer's count, all the rescuers roll the patient back down onto the long spine board. Positioning note: the patient must be centered on the backboard, and the top of the patient's shoulder must be aligned with the top of the uppermost slot on the board that leaves adequate room for the patient's head on the board. If it is necessary to adjust their position on the board, the student directs movement of the patient, ensuring diagonal motion only, no sideways motions.
Using cross straps is extremely easy. To get started, you will separate the straps. Select the smaller of the two straps, find the loop end, and then slide it down the hole closest to the patient's shoulder. Pull it tight and cinch it in place. Make sure it loops over the patient's chest. I'm going to go to the opposite side and select the opposite long strap that is adjustable. I'm going to find the rib area. I could go about here or a little bit lower. I'm going to select a little bit lower because this patient has a shorter torso. If you had a patient with a longer torso, you might change the hole selection. But at this point, I will select this hole. Put the clips together, pull and cinch. Make sure it's resting over the shoulders. Make any adjustments at this point. If the patient was pregnant or they have large breasts, you want to make sure that you do a center cross on the sternum. Now we'll take the other opposite end short strap, slide it through the same shoulder hole, through the loop, cinch it tight over the shoulder, kind of like a backpack. You will take the strap from the other side using the same holes. Make sure your strap is on top, and you're going to select the side with the hole, the loop. Slide it through, cinch tight, and clip. Pull the strap. Sometimes you might have a little twist, just adjust it, and now that area is secure. If you have extra strap, you're going to fold it over and you're going to tuck it under.
Strap note: each strap consists of a pair of half straps, each with a male or female buckle end and a loop end. This loop will be used to secure the strap to the board by running the buckle end through it and around the slot on the board. All strap loops should enter their respective slots in a downward fashion before being brought around and having the buckle end of the strap passed through them. Student places torso X, places the first strap at the top of the slot above one shoulder, loops one half of the strap through a hole to secure it, running it across the torso in a diagonal direction towards the slot near the upper hip, secures the second half of the strap through a slot and connects it with a strap from the shoulder.
Now we're going to strap the hip and thigh area. My target is to secure this general area. So the first hole I'm looking for is right at the groin, slightly below. So I will select the small strap, put it through the loop, cinch it tight. And at this point, I would be wondering, does this patient have anything sharp, hard, or anything that can break, harm, or cause discomfort to the patient? If there is anything, you may have to empty their pockets. Now I'm going to take the adjustable strap, which is going to be on the belt line, and find the hole there. It is okay to share the same hole as the upper strap if necessary. It just depends on your patient. If the patient has a longer torso or their hips are a little bit lower, then they won't be sharing the same hole on the longboard. Now, you're going to take the opposite end and you're going to connect it to this one. So first, you find the belt line. Find the same hole that's being sheared. Connect the straps. Remove the slack. Now this one's overlapped. I'll have to remove some of the slack. Now I'm going to find the same hole. Tighten. Any leftover strap, you're going to tuck it under. Do the same on the opposite side. Get any extra strap here, as you did before, and tuck it under. Now we have the hip area secured and we have the chest area secured. Crisscross.
Student repeats this process starting with the slot above the second shoulder. Tightens the X across the torso. If tilted head down, the strap must prevent the patient from sliding up. Student states, I would place pads as necessary to ensure no voids between the torso and the straps. Student places mid-body X. Similarly to the torso X, places straps to secure hips and mid-thigh. If necessary, the lower holes that were used for the torso X may be used for the upper straps of the mid-body X, provided the straps do not twist or pull on each other when securing the patient to the board.
To secure the feet, take the short strap, find the loop end, and slide it down, and somewhere between the knees and the ankles. Cinch it tight, put it across, over to the opposite side. Find the hole straight across, slide it under, open up the loop, bring the buckle through, push down, cinch to secure. Now make any adjustments that you may need to at this point. Slide this over, around the feet, and buckle. Make any adjustments as needed. If the buckle is on the patient's foot and it's going to cause problems, make sure you put some padding there.
Student secures lower extremities. Secures both sides of the fifth strap to the bottom end of the slot just below the knee area on each side. There should be no strap pressure on the knees. Student runs one strap in a diagonal direction across the lower legs, ankles, and around the bottom of the feet, shoes. Bring strap back to connect with other buckle. If tilted, the patient should be able to stand on these straps without sliding.
For patients with longer legs that exceed the length of the longboard, you want to make sure to pad for comfort to prevent any pain or discomfort in the patient's legs.
Longboard note. For patients with longer legs that exceeds the length of the longboard, make sure to pad for comfort to prevent any pain or discomfort in the patient's legs.
After you are done using the cross strap to secure the patient to the board, you will need to secure the patient's head to the board. To do so, you're going to have the person holding C-spine lift up the head slightly, about 1.5 inches. At that point, you as the rescuer will be grabbing the stay block and sliding it underneath. It would be at this point
that you would detach the plastic and slide it out. And actually do them both at the same time and slide it out. But for the purpose of training, we're not removing the plastic tabs. Also, your patient will have a different size head, different size upper torso, and the patient may end up even as high as this area, which is the design of the board. But for the purpose of this mannequin and the holes that I've used, it's going to interfere with these handles, but that's okay. That's for the purpose of demonstrations. But you might end up with a pediatric case that would be centered on the board and their head would end up here. Now you're going to get these stabilization wedges. And as you can see, there's Velcro on two sides, and this smooth side would go on the patient and you would slide it down. If the person is holding C-spine, they would lift up their hands and then still continue to hold C-spine. You would then grab the forehead strap, place it on the patient. Now this holds the patient to the headbed, but now you got to secure both the headbed and the patient to the board. And to do so, you will get your tape. Now, you would go around. We're going to go ahead and take off this. For the purpose of your class, you will not be removing the sticky tape because it's a lot of trouble. You would be putting it across the patient and the headbed, making sure that you fold a little bit so that the edges of the tape does not come in contact with the skin or the eyebrows and cause problems. You're going to stick the bottom part of one end and then stick the bottom part of the other end underneath the board. And for added protection, you will add tape so that this doesn't come off. You're going to get your 2-inch tape. You're going to put about 2 inches underneath the board. You're going to come up and across the patient's forehead. And then you're going to measure. So now you're securing the head and the headbed to the board. Make sure that you get about 2 or 3 inches extra. You can ask your partner to help lift the board. Sometimes a rescuer will lift up the board and someone will stick their foot underneath. Now this tape has a tendency to twist a little bit, but that's okay because no matter what I do at this point, this is not coming off. And this will stabilize the patient. If you had an assistant holding C-spine, it would be at the time when you start taping that you would ask them to release C-spine immobilization.
Student secures head. Places the stay block pad centered on board, under patient's head, occipital region, with minimal movement of the patient's head. Aligns pad just high enough to leave room to place support blocks above ears. Note on taping the head. In the field, the tape goes across the patient's forehead and potentially the eyebrows. The tape adhesion to the skin is important to prevent the patient's head from moving. Student tapes head. Applies 2-inch cloth tape to one side of the board, directly across the patient's forehead, over the Velcro strap but not over the patient's skin or eyebrows, and down to the opposite side of the board. Tape should wrap 2 inches under the board's edge on each side. Student applies a second piece of cloth tape from the board near the patient's shoulder at an angle up to the first piece of tape, across the patient's forehead, not over the patient's skin or eyebrows, and down to the same location on the opposite side of the board. Tape should wrap 2 inches under the board's edge on each side. Student states, I would now instruct my assistant to discontinue manual C-spine immobilization. Student secures hands, restrains hands securely on midline for transport.
To complete this assessment, you're going to be running one last neuro assessment on the patient's hands and their feet. You'll begin by assessing the patient's movement. Can you move your fingers for me? And you will be checking for sensation. Can you tell me which finger I'm holding?
Index finger,
Can you tell me which finger I'm holding?
pinky, right hand.
Thank you. Can you wiggle your toes for me? Can you tell me which toe I'm touching?
My big toe,
Can you tell me which toe I'm touching?
my left pinky toe. It will be more difficult to assess motor and sensation on a pediatric patient because they're not going to speak to you. But you can check for movement and sensation by simply touching the bottom of their feet. It'll make their toes go in And if you touch the back part of their heel, it'll make their toes spread. Once again, their toes will try to grip you, and if you grab their heel, their toes will spread open.
Student reassesses SM on all extremities. Hands. While holding wrists, instructs patient, please move fingers of each hand. Asks patient, which finger am I touching? Feet. While holding ankle joints, instructs patient, please move the toes of each foot. Asks patient, which toe am I touching? Student states, I would then transport to a trauma center code, depending on how stable the patient is. The student will state what code they will transport the simulated patient to the proctor.
My name is Don Chislow.
And my name is Robert Gamble. And that concludes the spinal immobilization technique.
This concludes your instruction.
Thank you for watching Lomeli EMS Productions. I hope you enjoyed the training video. We look forward to producing more in the future. Remember, live for today, learn for tomorrow.